10 seconds. We're just starting. Okay, Councillor Islam, you are actually live now. The meeting has started.
Thank you very much. Good evening, everybody. Welcome, resident, to our first virtual Newtown World Forum meeting. We have decided to hold virtual meeting during the lockdown because of the COVID-19 pandemic, to give you the opportunity to get important word updates and to answer any word-related questions and queries that you have. Please use the question and answer facility to ask any questions that you have, and we will try to answer them. If you are unable to answer, if we are unable to answer them during the meeting, we will come back to you outside of the meeting if you leave your email address. Please be patient and bear with us as we learn together. Just I'm reading the notice of recording. Residents listening or participating in the online meeting to be advised that a recording of this meeting will be available for future record. Thank you. So we have only two agenda today. One is COVID-19 update, which I believe that Dr. Justin Barney already here. So he will, I just, would like to pass on to him to say something about the current, the situation of the COVID-19, so that the resident of Newtown will hear, and probably someone will have some questions, so that will be answered as well. Thank you.
Great, thank you, Councillor, and hello everyone.
Thank you.
So I'm going to give you a brief overview about where we are on COVID. I think this is the first time I've joined you in Newtown, isn't it?
Thank you.
It's your first online. So I'll give a brief overview about where we've been. I'll talk a little bit about inequalities. I'll touch on vaccine and testing, and then I'll talk about where we're going next. So COVID-19 first appeared in the world back in December 2019, then came to the UK in early February, initially from people travelling back from Italy and from China. Then we saw transmission within the UK, and we saw the first case come to Birmingham in the early part of March 2020. And then since then, we've seen quite rapid acceleration in terms of the number of cases. We went into lockdown at the end of March, and in Birmingham we had two peaks actually. The first peak around the middle of April, and the second peak around the middle of May. And then since May, numbers started to come down. Things started to open up around the middle of June, and then through July many shops and businesses reopened again. And the numbers stayed relatively low until around the middle of August, when we started to get a small peak. Then they came down again, and then at the end of August we saw a very, very big peak. So what we've then happened is we moved into what's called an area of enhanced support, and that meant we got more support from government to open additional testing sites. So we moved from having the one pilot walkthrough site on the border of Newtown and Lascelles to now having 7 walkthrough sites across the city, and we are working to have a total of at least 10 across the city, and that's in addition to the drive-through testing sites as well, and we've got 2 of those now. So as the numbers continue to rise, we then moved into an area of national intervention, and that's where it became part of law that it's illegal to go into someone else's private house or private garden. And that was because the majority of spread that we've seen in Birmingham is to do with people going inside private houses and private gardens. So we're seeing that, and we have seen clusters of outbreaks of cases in children, for example, which all link back to a children's party, or we're seeing a birthday party or a barbecue, all of those things linking people together, and that's how the virus has been spreading. And when we look at the contacts that are identified from cases, Over 88% of contacts are either people that you live with or people who visited your house or you've gone to visit their house. It's a very small proportion of contacts that are workplaces or people that have been put at risk going to the pub or in a restaurant or anything like that. So excuse me while I have to turn off my oven while we talk. So we're seeing, that's why we got the restrictions on household mixing, and those have now been in effect for a couple of weeks, which means that we're starting to see the impact of those. And normally when we have restrictions, it takes 2 to 3 weeks for those restrictions to come into effect. So we're just starting to see the impact of those changes playing out now, and the case rate is starting to reduce, which is a good sign, but it's too early to relax and it's too early to say that we're definitely out of the woods, because Birmingham has a very particular pattern where we go up a bit, we come down a bit, and then we go up a bit more and we come down. And what I'm worried about is that we have this weird step-like pattern in Birmingham that we don't see actually in other areas. So it's looking positive at the moment. Testing rates are up, which is good. What is not so good is we're seeing hospitalisation increase. So we have seen an increase in the number of people coming into hospital, and sadly we're starting to see that now translate into an increase in the number of people who are dying as well. And what we're seeing now in hospital probably reflects what happened in terms of the initial peak at the end of August and the beginning of September playing through. So a couple of weeks later, we start to see that play through in hospitalizations, and a couple of weeks after that in deaths. So that's why we're starting to see that pattern now. I think the next thing I want to touch on is the risk factors, because I think this is a really important point for everyone who's watching. There are 6 main risk factors that increase your chances of dying if you catch COVID. 3 you can do something about, and 3 you can't really change. So first of all, there's your age. So the older you are, the higher the risk of you dying if you catch COVID, particularly if you're over the age of 80. If you're a man, you're more likely to be severely unwell or die than if you're a woman. And if you're from an ethnicity, from an ethnic group that is not white British, then you have a higher risk of being seriously unwell or dying if you catch COVID. Now, the gender and the ethnicity aspects reflect the 3 risk factors that you can do something about. So the first of those is smoking. Smoking is strongly associated with an increased risk of dying if you catch COVID. And men smoke more than women, and there are some ethnic groups which smoke more than white British groups. So that's one of the reasons those groups have a higher death rate. The second reason is obesity. So if you are carrying those extra pounds that many of us put on during lockdown, it's a good time to get more active and try and reduce them. But really, people who have a body mass index of over 40 are particularly at risk of being severely unwell or dying if they catch COVID. And again, those things, men are more likely to be overweight and obese than women. And similarly, some ethnic communities have a higher prevalence of obesity as well. And then the third risk factor is having a chronic condition. So a long-term condition like diabetes, high blood pressure, kidney disease, or chronic airways disease. And this one has 2 parts. First of all, having the condition increases your risk of being very unwell or dying. And then secondly, if that condition isn't well managed, so if, for example, you're a diabetic and your sugars are always going up and down, then you are much more at risk than someone whose sugars are really well controlled. So at the moment, as we see case numbers rising, it's really important. Anyone that has those 3 risk factors that you can change, whether that's you're a smoker, you're obese, or you have a long-term condition that you're not really controlling quite as well as you should, now's the time to fix it. Now's the time to take action, because every little bit will just increase your chances of doing better if you do catch COVID. So finally, I'll just talk about vaccine and I'll talk about the antibodies. So first of all, the test that you can get through ringing 119 or going on the NHS website is if you've got symptoms. That's the one that's like a giant cotton wool bud. It goes at the back of your nose and the back of your throat. And you can book an appointment either at the walkthrough site or at the drive-through site, or get a postal kit sent to your home. That's looking for have you got the virus now? And that's most effective if it's done within the first few days of getting symptoms. Now, the other type of test is an antibody test. So that's looking, does your body know, have you had the disease, and does your body know how to defend against it? And that should be a test that's done by taking blood from your arm. And at the moment, that's only available to people who work in hospitals or for patients coming into hospitals. You can buy it privately. It's usually about £100 to £150, but frankly, I don't think it's worth spending your money at the moment. And the reason I say that is that we know about a third of people who definitely had COVID don't develop antibodies. And of the 2/3 that do develop antibodies, about a third of those forget how to do it. So their body just doesn't learn how to do it properly and they forget. About a third of them make them, but they don't work properly, so they don't defend the body. So you end up with only actually a third of 2/3 who actually have any defense. And we now have some really clear evidence from the UK of people who definitely had COVID back in March or April, who've now definitely caught it again. So it is absolutely possible to catch it twice, and that's a really important message to get across to people. And that's why I would say don't waste your money on the antibody. Focus on what you can do to reduce your risk, focus on staying safe and keeping your family safe. Now, finally, those key points about what can you do to keep yourself safe? Well, the most important thing is stay alert to COVID. Keeping that social distance of 2 meters, washing your hands regularly, avoid touching your face if you haven't washed your hands, and wearing a face covering that goes from your nose to under your chin if you're going inside a building that you don't live in, or if you're going in a taxi or on public transport, bus, the tram or the train. Really important to take these simple steps. They're really simple things, but they are the things that stop the virus spreading. So it's an important thing that we all do, that we take responsibility for that. The two final things that I'd flag, one, that we've set up the COVID community champions. It'd be great to have lots of people from Newtown signing up. You can sign up through the council website. That gives you regular email updates from my team. There are regular webinars where I come and answer questions from the champions. We also have text messages going out that you can share with your friends and family, and it's full of tips and simple things, as well as the most up-to-date data, so that you can help us make sure that everyone in the city knows how to protect themselves and keep themselves safe as the numbers rise. We are now definitely approaching the second wave, and the important thing is we do as much as possible to keep ourselves, our families and our communities safe. So I'm happy to take any questions that you have for me, Councillor, or anything from the Ward Forum.
Thank you very much. It is really very important to hear your comment. One or two things before anybody wishes to ask any question. One thing, first of all, the Villa Street Centre, which is the new one, is there any way, what is the function of that one? This is the one question. The second one is about as you mentioned, about the obesity and the smoking and the underlying condition. These are the conditions. It is good to hear that in the Newtown there are lots of people. Another thing, there are third one, which is because I know that you have done about 20-30 languages. But all this has been, the leaflet already been sent out to alert people. What about, because Newtown, we have a mixture of people, especially there are lots of Arabic speaking, which is from Somalia, new community, already within the Newtown community. Have you done anything in Arabic from your side? So that would be very useful if you can tell me. Thank you.
Sure. So the Villa Street site was actually our first walkthrough testing site. So people when you go online to book a test, it will ask you whether you have a car or not. whether you have access to a car. If you don't have access to a car, it will either offer you a postal kit, or if you're close enough to a walkthrough site, then it will offer you a chance to get an appointment at a walkthrough site. And walkthrough sites are only offered to people that live within walking or cycling distance of these sites. So it's quite an important kind of thing to understand, first of all, that actually the Villastri site won't be offered to people in Dudley. For example, it will only be offered to people that live. Realistically, it gets offered. So when I was unwell earlier in the a month or so ago, I got offered a test at the Villa Street site, and I live at the Cube, so down in Ladywood, I think I am. But it's a bit of a trek to get there, but you could just about imagine that someone could walk that. So what that site is there for is to enable people who book tests who don't have a car to be able to get access to a test. They have appointments, so people aren't queuing up outside. They're turning up, they're getting their test, they're going home. This is a model that's been around for a while. There are other parts of the country that have them. There's no evidence of any risk to the community of having it there. There's no evidence that by having this, people bring their illness into the community. But what there is evidence is actually by having a walkthrough site in your local community, you've got the best access to testing of anyone, because you kind of got preferential treatment to get it. So it was really important when we're deciding where it was going to go, and there's a limit to where you have to put it. So these things have got a certain footprint. It's got to be a tarmacked or gravelled piece of land. You know, we couldn't just put it everywhere. It has to be outside, not inside. But we were trying to find areas of the city where we had a large number of people didn't own a car, and that's one of the reasons Villa Street is where it is. You know, we've similarly had some down now in Spark Hill, out in Saltley. We've got them dotted around the city, but we've really tried to put them in places where lots of people don't have a car, and therefore they can't access the drive-through site. So I hope it's seen as a good thing, and certainly I think some of the feedback we've had from the community has got much more positive about it and seeing it as a useful thing. In terms of the support for people who want to get healthier, and I've put it in the Q&A, the link, we've developed a tool called Be Healthy. So Be Healthy is basically a booklet that's about how you can become healthier. So it's got a checklist, simple things that we can all do. We translated it into about 21 different languages. Arabic's the second one in the list and the download. So after English, it goes to Arabic and then Bengali and then Chinese. We've also done a series of webinars where we've been talking through the issues in more detail. They're recorded and available on the website as well. So please do have a look at Be Healthy. It's a really simple tool to just help all of us get a little bit healthier.
Thank you very much indeed. Thank you. It is very useful. Is there any questions? Is there any questions?
There's a question in the chat box.
Yeah, shall I pick up the question from Natalia? So a question from Natalia that's come through in the chat that says she saw a party taking place one night, and it sounded like a lot of people, but it was in the block of flats opposite. Who should I report it to, and how does it get investigated? So and this is one of the things to kind of, I think, help explain to people. If you see a mass gathering, that's a police thing to enforce. So basically, if you see more than 6 people coming together and they're breaching the restrictions, which are on you shouldn't come together in groups that more than 6, then you report it to the police. And you can do that through the West Midlands Police website. They've got a reporting form for that, and it tells you, basically click through. You can also use that form if you want to report someone going into a house that they don't live in, or someone who's not wearing a face covering, say on public transport, or a business that shouldn't be open. So there are some businesses that are still not allowed to be open. There's also a live chat function, and I think also there is a telephone version. So if it's a breach of the number of people coming together, or face coverings, or people going into houses they shouldn't, that's a police thing. If it's a business that isn't, for example, socially distancing its staff, then that's a council thing. And on the council website, you can report to the council any things that are to do with businesses, and we follow up. Now, through the council website, we've had over 1,000 situations reported to the council. They've all been followed up and investigated. I would say about 95% of businesses take the advice on the chin, do what we're asking them to do, and improve things. And those that don't, then we take action against. And some of you will have seen in the local media where we've taken action to close venues, to issue notices. So restaurants like the Tipu Sultan, I think many people will remember a couple of weeks ago we took action, and it's really improved. It's a lot safer environment. So if you do go into a restaurant or a bar and it doesn't feel safe, first of all, go somewhere else. Keep your family and your friends and yourself safe. You wouldn't walk into a fire trap. Please don't walk into a COVID trap. And then secondly, when you get home, go onto the council website and report it, and we can follow it up. And I've put both the links for the police and for the council into the Q&A box for you.
Thank you. Just one thing, because I'm getting all the information from the resident. Sometimes they are saying in a flat or somewhere, neighbors, they are actually having a party, because as before, they do not care about this, about this problem. So people are reporting me. I reported about 2 of the restaurants in Newtown, and I think it's been actually been looked at by the appropriate department of the city council, and I think there will be push on or whatever it is. So it is a good practice, but I'm urging the resident of Newtown, if they see anything, if they feel anything, neighbors or anybody doing something like you said, so over 1,000 people already will contact the city council. Neighbors are actually making COVID-19 rules or whatever. The city council impose whatever they impose, so they do not listening or not caring about it. So it's a good thing. So I'm asking the resident of Newtown, they should actually check upon, and they should not be frightened to report either myself or to the city council. There are lots of sources they can report to the council, so that an action will be taken. Anybody else to any other questions?
There's a few more questions in the Q&A box.
Can you help me to who is the next one then?
Justin, you're on mute.
Thank you. So yeah, another question. If I'm told to self-isolate from traveling to a high-risk country, and I live in a flat, am I allowed to go outside the flat to dispose of rubbish or go to the letterbox? So I would say yes, you would be. What I would say is be very don't do it every day. You want to try and keep anything that puts you into contact with other people when you're isolating as low as possible. So what I would suggest is only take rubbish out when you really need to, and go and check your mail every other day or every 3 days, rather than doing it every day. And the bit you need to be really conscious of is if you're going outside to do, you're going in your block of flats to do that, make sure you've got a face covering on. And what I would suggest is take something else to hold the door handles, because the risk is you're going to contaminate the door handles and someone else is going to touch it. So whether that's like a surface wipe would be something useful like that, that's got cleaner on it, cleaning product. You've got to be conscious of those common touch points. That's the risk, but do it as little as possible, and only really if it's essential. And then there was a question about testing. So And the person said, how often can I be tested during this climate? And if I test negative and I feel like I have the virus, who do I go to for a second opinion? Okay, so you should only get a test if you have one of the 3 symptoms of coronavirus. So if you have a high temperature, or you have a continuous new cough, or you have a loss of sense of smell or taste, then you ring 119 or you go on the NHS website to book an appointment. And that's the only way you should be getting a test. Now, the one exception is if you are asked to by the public health team, so that will be either be a member of my team at the council or Public Health England. And in general, we only do that if there's an outbreak in a workplace or a school, or it's a highly vulnerable setting like a care home. So for most people, unless you are explicitly asked to by the NHS or by public health, then the only way to get a test is if you've got symptoms, or if a member of the council staff comes and knocks on your door because we've come to you as part of the drop and collect pilot. And the drop and collect is about focusing, doing blanket testing in small geographical areas where we've got a spike in cases and not enough people are testing. And we're worried that we're missing houses where people might have symptoms and they're just not testing because of a low testing uptake. Now, in general, when we are coming to an area, we let the ward member know. So we let the councillors know the night before that we're going to be coming, so that if anyone wants to ring and just check, they can check with the councillor that it's a legit person on the door. If it's a member of the council staff, they'll have a high-vis jacket on. It'll say Birmingham City Council on the back with the logo. They'll have an ID badge or they'll have a letter from the council. The test is free. They won't charge you and they won't come in your house. They're just there to give you the test and then they collect it and about an hour later. So you can't just get tested because you feel like it at the moment. It's only if you've got symptoms or if you're in one of these very specific groups. There's no point getting a second opinion because the tests are very accurate. So if the test says you're negative, I think you probably are negative. And it's probably something else that's making you feel rotten. There's lots of other stuff going around at the moment. So there was a point about businesses not enforcing customers to wear a mask. And yeah, so we have been as the council reminding businesses. We've been working with the business groups, so the Chamber of Commerce, the business improvement districts, to remind businesses they are supposed to do this. But it is important, if you do know, please let us know and use the web portal to report it. It's important to say we don't jump in and go straight away with a fine. Where businesses are reported, generally we ring them up and have a chat, or one of the environmental health officers goes and has a visit and sees what's going on and says, did you know that you've got a responsibility to do this, which now they do under law. So the more you can tell us where things aren't happening, the better it is, because we can actually act on it. If we don't know, we can't be everywhere and we can't see it all the time. And it's important also to say that the reporting is anonymous. So if you report through the web portal, it is anonymous. And it's really, the more specific you can be about which shop it is, what time of day you went, those kind of things are really helpful for us in terms of being able to follow up. And as I said, most businesses, when we point it out, they do the right thing and they change their practice. It's very rare we have to go back to businesses multiple times. And sadly, the ones that we do are often the ones you read about in the newspaper, where we've ended up having to take enforcement because they've kind of had 3 chances to get it right. And the 4th chance, I'm sorry, it's into a fine or a restriction notice.
Any other questions?
I think that's all the questions, Councillor Islam, for Dr. Barney.
Okay, can I just comment something? Thank you very much on what you have said. One final thing from me about the flu job, the normal winter vaccination, how important it is for the elderly people and the people over the age of 60 or 65 the people who are suffering diabetes, this sort of thing, how important it is, and is it useful for the COVID-19, the infection as well? If anybody, for example, I took it a week before, so is it important for anyone to take it as like as other?
Yeah, it's a really good question, and thank you for raising it. So the flu jab this year is really important. If you're someone that in a normal year is entitled to a flu jab because you're over 65 or you've got a chronic health condition, please, please, please go and get the jab this year. You should be able to book an appointment with your GP. Some of them are working with pharmacies to make it happen, but it's really important you get it sorted early on, because what they're doing this year is they're extending the categories so that once they've vaccinated everyone that would normally be vaccinated, who are the most vulnerable, then if there is additional vaccine available, they're going to offer that to people who are aged between 50 and 65 who don't have long-term health conditions and wouldn't normally be eligible. So it's really important this year to not leave it late, get on and get the vaccine. The flu vaccine doesn't protect you against COVID, sorry, but what it does do is it stops you catching flu and COVID. And we have seen evidence from Australia where they're in their second wave and they've also got flu circulating, is that if you catch flu and COVID, you are very likely to end up in intensive care and you are very likely to die, unfortunately. So you might as well get the jab and get one thing sorted, and that's one less thing to worry about this winter.
But it's really very useful. Thank you very much. Thank you. Thank you for your attending, and I'm sure the residents of Newtown have listened and your advice. Thank you. Should we have our thank you? Should we have our second one? Should we start? We waste management update. We have here Les Williams from who is the principal operation manager. So he will be actually outline some of the recent events within the fly tipping and all these things within the waste management. So please do start. Thank you.
Thank you for that, Councillor. Well, thanks for the invite, firstly. And first, before I start anything, can I just thank everybody around listening that our guys have worked through the COVID, through the lockdown, etc. And we've been able to offer a good service all the way through. And a lot of that is down to residents doing what we were asked to do through March, April, May, June of stopping at home. It allowed us to get out, do our job with little interruption to any service. So we're quite proud this year that we've done really well with the COVID virus. Things are ramping up now. We know that there's a second wave coming. And we are seeing in our services now more people getting symptoms, getting the virus. And again, you know, we can only plead to people like Dr. Varney just has, you know, be mindful, because if we get it and go down, obviously rubbish piles up on the street. So we're doing our best to avoid that. With reference to miscollections and dumped waste, if it's okay with you, Councillor, I've got a couple of graphs I'm going to put up on the screen, if it allows me to do so. Just when I can get down my documents. Not leaving me. There we go. Sorry. Hopefully that's come up for you, Councillor. You can see that.
Yes, yeah.
Right, okay. If I do fall off, I'm getting a warning of bad network quality, so I'll endeavour to keep going. So this first graph, if I just move it down slightly, this is the dumping that we're receiving at the moment in the ward. So this is built over the last 2 years. We're going back to literally 2 years to running date. The week 39 is what we're on in this current fiscal year. And we can see in the last third of the graph that things are increasing with dumping. This is not just in Newtown or in any ward in Birmingham. It seems to be countrywide. We look at other councils across the country, and we are seeing, again, across the country, an increase in fly tipping and dumping. Obviously, we're out there. We'll pick up what we can, and as soon as we can, and and we do ask any residents that if they do see it happening, that they contact us to get it cleared. Firstly, as soon as possible. But secondly, if you see the person dumping, it's really helpful for us if we tell on them like we're doing with the coronavirus with groups of people. If we can catch the people that are actually doing it, we intend to prosecute. It's really difficult if we have no witness statements or witnesses come forward. So, we're doing our level best that we can, but I can also advise we're putting extra resource in to try and tackle this. I won't use the word epidemic, but this increase in dumping across the city. The second graph I want to show you is now this is our miscollections that we get reported, and I've done it just for the ward. Oops, sorry, excuse me. So it's a bit of a smaller graph, but again, it goes all the way back to February this year. And if we look, there's generally quite a line along the bottom. We only get 1, 2, at the most 7 miscollections in any 1 week for the ward. So since the lockdown, again, our services have been really good. I'm quite proud to say, and we are getting few reports of miscollections from residents. Notwithstanding that, we always want to get better. I want to see a clear graph, but if I compare that to last year's, there is a significant change in miscollections. A lot of the things why we're getting less are, you probably noticed we might be out a little earlier in the mornings. That's purely because we need to get our guys in and out before people start moving around. And now the lockdown's eased to a large degree and people are out going back to school and college and work. We're trying to get in front of people so we don't intermingle, if that makes sense. We're just going to share that screen. Okay. So that's where we are with our miscollections and dumping at the moment. It is an uphill struggle, specifically with dumping. A bit of good news this year. This year we've got some funding to clear the leaves off the streets. Now we used to do this up till about 4 years ago, where our funding was taken away. We've managed to get the funding to bring that back. So we've started crews just about now, but we've got crews across the city that will be triaging when the leaves really do start falling to get them off the streets and the pavements. So so we get the city a lot cleaner again, and our plan is to do it obviously just before Christmas to have it all cleared up. I think that's all I can update on at the moment. Again, I can only thank people for being involved or not being involved with us. If there's any questions or queries that anybody's got, I'm quite more than happy to take any questions back.
Thank you very much. Yeah, thank you. I got some 1 or 2 minor questions to understand. Have we got any, because in the place I'm living in Peribar ward, I live in a part of Great Bar, and we always have a winter time mechanical sweeper. And the tree leaves already been fallen, the autumn time, and it's already been looked like very clean. And what about in Newtown? Have we got the operation of the mechanical sweeper in Newtown? If it is not, why not? And so this is the one thing. And the second thing about the there are 3 places from June, something like that. When I went out to check, and there are lots of dumping always happening. Anyway, it was previously as well. And some people took photographs of the culprit. Unfortunately, the resident, those who took the photograph, they are reluctant to give the written statement, as the officers asked for it before they prosecute the criminals. So I tried my best to pursue the resident, those who actually saw the events, but unfortunately, even today I tried, and I had to email from Alan Jones today because he tried to get the statement, although I named them. are unfortunately they're reluctant to do it. But as an expert, probably you can advise me. For example, if a person took a photograph, clearly photograph is there, and they know the address, is there any, without taking the statement from the person who's seen it, is there any way can the waste management take these people to court or whatever it is, to take some action to stop it? So this is my two questions. If you can, clarify for me, if you don't mind.
Okay. The first one on the mechanical sweeper. I probably should have mentioned this in my first part of the submission. The large mechanical sweepers, they're what we call an heavy goods driver. They've got a specific license. And in order for us to offer the service for refuse collection, recycling, green waste and the bulky waste collections, we've had to dip into our colleagues from street cleansing and some of our colleagues from our parks department, who we now share the same role with. That has meant that we have had to stand down a couple of sweepers. It's not been for a long time, but it has cost us some days. We do know now, going into the leafing period, that large mechanical sweepers do the work of probably about 30 men. So that won't happen in the future now. We are fully manned as well with agency and full-time staff on our refuse collection. So we should see a significant increase on the frequencies of the sweeping. So I will take that back to the depot anyway and speak to the local management team there. Now, dumping and reporting, it is, if somebody sees and takes a photo of someone doing it, when people dump and we catch, it's classed as a crime scene, and they have to jump through many hoops like the police do. They have to prove beyond all doubt. And that's why when we ask someone to give a witness statement, we also ask them, if needed, would you stand up in court to say you've done it? Now, lots of people are fearful of that and stand down. They don't want to do it. What we can do, if we see a car or a van or a person regularly dumping, we can manage and monitor that and catch them ourselves. So if people do see it and it's outside across the street from where they live and that, if they can get to people like myself, we'll manage it, we will catch them ourselves and we'll take them to prosecution and that. I do understand it's, in the ideal world, we'd like to catch everybody as they do it and fine and crush their vans if it's a van that's doing it and that. But we are reliant on people telling us so. But again, we're sort of reliant on people standing up in court as well with us. So it is a very difficult and a challenging task to ask people.
Yeah, thank you. It is a citywide problem. It's in Newtown, Aston, everywhere. I know it is a citywide. Okay, have you got any other question, Pat? Anybody?
Councillor, a couple of questions in the Q&A.
Okay.
I'm just reading as we're there. So I think it's the first one from yourself, Natalia, and it's oh no, I've lost you. Sorry, excuse me. I want to be clever. Where to report leaves collected from the street. So with the leaf fall, we triage it like anything else. If you got what we call the conker trees or the big broadleaf trees, they generally drop their leaves first. Unfortunately, them leaves take up a lot of space on the floor and they do get very slippery. So managers in depots generally know where the bad spots are and where the cleaner spots are, and they do triage it. But if you do get a point outside your house or somewhere where you have to walk to the school or wherever that you think is really bad, if you ring the council's contact centre or go online, you can report it like you would do a miscollection. And what we do then, we'll put in again into the triage queue and come and pick it up as soon as we possibly can. And Natalia, you've also asked, there's an issue of grass cutting crews going in and out of the grass, the shred rubbish, plastic bottles, the crisp packets. Yes, so just for advice, the Parks Department for the grass cutters and the edge pruners, they are now becoming part of Street Scene, which is based up of refuse collection, street cleansing and the Parks Department, and we'll have our own arm of enforcement. That's happening as we speak. So any areas like where you're seeing that, Natalia, we're going to work in conjunction with each other. So the day before they cut the grass, we will be able to litter pick it, so we don't get this shredding that we're seeing. They do have crews that do it, but I do understand they've got a big mammoth task. But I think in the future, in the very near future, we will be working very close together, and that practice or that shredding of paper and crisp packets will stop. I think that we've probably done the last cuts for this year now, so the grass will rest over the winter time, but hopefully by when we start the grass cutting again next April, we'll be in a position where we're working hand in hand, clearing that mess before we actually cut the grass. And Natalia, again, you've asked about how we're working with the homeless shelters at Snow Hill. We've got lots of litter, especially beer cans, just outside the homeless shelters and the canal entrance. I'm just trying to think. Yes, we're doing a big piece of work at the moment with the homeless to look and help and support them. The winter's coming. We've got places where they can go and stay for the night. We do highlight spots like that canal bridge, or where they go down to the canal by Snow Hill. We do start our street cleansing service in the town at 4:30 in the morning, and what we do, we prioritise that as one of our first stops of the day. We also keep a regular attendance there, so it probably gets visited 5 or 6 times a day. But I can probably send some information, because it's just emerging now as we're talking, about the steps we're putting in place to help and support the homeless, and it might be worth sharing on any pages that you put out to local residents. So as soon as I get that, and it is imminent, I will share that with you. Just refresh.
There are no further questions.
Right, okay. I just picked up your one there, Pat, about we do use the waste prevention team. We do use obviously the homeless team, but what we're doing, we're actually joining up, so we all work together. So we tackle the litter, we tackle the unsearchable parts that come along with homeless people and that, and we're looking to rehome and etc. But as again, it's just emerging now as we're going into the winter. So I'll be able to update as and when that happens, but we're talking days rather than weeks on that one.
I got only one minor, one minor point. The Snow Hill area, which is within city center side, and we have visitors coming in always, and I think we should give an extra care for the city center side. Is there? I know there are lots of fly tipping, and there are lots. I know your department doing, doing what they can do, but I think we should regular monitor to check is there any fly tipping, so that we outsider coming in that should not have a bad impression about Birmingham City Centre. So I think probably as a senior person from the West Birmingham, if we can do something for the city centre site, so that we can see a very clean city, which is very useful for our citizen of Birmingham. So,
yes, I would like to be able to do that, and obviously I do see that as a daily challenge, that if anybody sees it, please report it. Obviously we're looking forward to 18 months now. We've got the Commonwealth Games, which is going to infringe all around our area. We will be putting lots more resource in getting the areas cleaned up, and we're going to do that now rather than just before. So it's not going to be polishing up before it happens. We're gearing ourselves up now to make the whole thoroughfares into Birmingham a much cleaner area to come in, so promotes Birmingham as a clean city. By and large it is. So, but if you see any places like that, please report it, because we want to get in there and tackle it.
thank you very much indeed. Any other questions for Les?
There are no more questions.
Okay, thank you, Les, for your time. Probably in the future meeting, we don't know when, because you attended in March, I believe, and now this is the second one. Thank you very much for your input, which is very useful to this resident of and we are very pleased for your attendance tonight. So thank you very much, and have a good night to you. So our next agenda is any other business?
Councillor, I don't know if you want to report to the audience any developments within the Newtown area, anything that
Okay,
residents
yes,
should
thank
know.
you. Yeah, thank you very much indeed, because hello, hello, is it all right?
Yes, Councillor Islam, you're fine. Carry on.
Okay, can I speak then? Yeah. One thing, my message is, if anyone, any resident sees somebody dumping, they do not be frightened of this person. Take a photograph or take the name and address and give it to the city council or to myself or any of the officer. So there should not be frightened. There is no need to worry about that. Oh, this person will harm me or anything. There is a law in this country, so that we like to keep Newtown a clean town, a clean Newtown ward. So it is effort of everybody, not one person. Everyone should, participate to catch the criminal, and this is one of the things we must do. And I also request those who are in attendance today to please tell their neighbors, friends to attend the ward meeting, so that they actually express their own concern when they will come to the city council, and the officers will listen to their problem, which will be very beneficial to each and every member of Newtown ward. Thank you very much.
Councillor, there are no questions in the chat box currently.
Okay. So I think I better to close the meeting, and thanks everyone, those who joined online. And really, we hope to actually meet again in January or February time. We'll decide the date and time, and everyone will be notified. Thank you. Should we close the meeting?
Yeah, if you finish, Councillor Islam, I'll end the meeting now.
Okay, I end the meeting now. Thank you.
Thank you. Good night.
Thank you. Good night. Good night, everyone.